Hi, this is my cardiovascular, respiratory, gastrointestinal, and genitourinary assessment. So first thing you would do first is do their vital signs. Always key first because you want to get their heart rate, their blood pressure, their temperature, and their respirations, as well as their O2 count percentage. So you would obviously do that first, and then you would ask questions if they've had any changes in their breathing, any shortness of breath, no changes, any chest pain is very key. All signs of cardiovascular issues, maybe respiratory issues, everything leading up to another. Okay. So then next I would look at her skin, see if it's pale, if she's sweating, because diaphoresis is obviously a sign that something is going horribly wrong. You would feel her skin for her temperature. It should be warm. She should not be sweaty. She should be, well, she's African American, so she's not going to be pink like a Caucasian would be, but she should definitely be a normal color, nothing pale, nothing too red, and stuff like that. So then you would also check her skin trigger. So you would take the back of her hand, pinch the skin up, and it should go down in less than a second. If it's pitting, there could be some fluid there. There's a lot of different things that could happen if it is pitting. You'd also check her fingernails at this point, so you would kind of press down. And then that's called capillary refill, and you would want that to occur in less than 3 seconds. And hers is bomb, so she's fine. Next, you would kind of check for edema, so you would feel down her legs, feel in her arms. You'd ask if she's felt any tightness anywhere, any changes at all. She feels fine. So there's different types of edema. You would look for pitting edema, which could be like +1, +2, +3. And then you would also just look for edema that's just like swollen. So that could be like no pitting as well. And also when you're looking at her fingers, you would look for clubbing. She's fine. So clubbing would just be like swollen fingers. There's a lot of cardiovascular issues that come with clubbing. So you really, really want to look at that and make sure you assess it. And then next we would check all of her pulses. So to do the JVD pulse, you would never check both at the same time. You always want to check one, count, and then check the other. So she's great pounding pulses, and then you could check her radial pulses on the inside of the arms. You could check her brachial pulses. Beautiful. And then they have a femoral pulse, which is right up here in the thigh. I'm not going to touch you in your groin. And then you also have popliteal pulses. Those are kind of harder to assess, so you sometimes have to get a Doppler in order to see those are good. And then she has ones in her ankle on the inside. And then she has ones on the top of her foot. Okay, and then next we would auscultate her heart sounds. So we're going to auscultate here. This will give us the sound of her aorta. Right here will give us the sound of her pulmonic valve. Down here would give us the sound of her tricuspid valve. And over here would give us the sound of her mitral valve, also her apical pulse. So all of those are key in order to assess S1, S2, any S3 sounds, which could be abnormal but also normal in someone who's pregnant, or S4 sounds, which is also another abnormal issue. And then you would also listen to her lung sounds anteriorly and posteriorly. So we would start up, and then you would go bilateral. So once you test her upper right chest, you would go straight over to her upper left chest, and all the way down anteriorly, underneath the breasts, and then over to the side to get those lower lobes. And then you would go posteriorly, the same thing. You would go starting up and go laterally to make sure you assess every sound. And it's very important to get the posterior part because you really can't hear the lower lobes unless you go posterior. All right, and then next we would assess for accessory breathing. So just breathe normally. So you're really looking for if she's using her abdominal muscles a lot in order to breathe. Any like accessory muscles basically. So if she's flaring her nostrils, anything like that. Her trachea alignment, which you do when you do a head to neck assessment, but making sure you assess that it's in line because any deviation could exemplify like a pneumothorax or some change or in pressure in her chest. Also important to say that I forgot to say, but when you are doing her respiratory and checking her lung sounds, make sure she takes deep breaths each time. in order to actually hear and assess those lung sounds. And then afterwards, make sure you tell them that they can breathe normally. Okay? And then you'd percuss for secretions. So let's say she has crepitus. The only way you feel crepitus for lung sounds is if you palpate and you percuss. So you kind of feel around, and if you feel like a crunch underneath your fingers, sign of crepitus in the lungs, and that means there's probably fluids building up in the lungs as well. Percussion, you want to hear a dull sound. Sorry, is that her? No. Okay. So that just means that her lungs are fine. She's breathing normally, so everything is great for her lungs. So next, moving to her gastrointestinal system, you would have them lay down. And first thing you would do is assess their chest. So sometimes you see barreling when it comes to respiratory issues because they're using a lot of accessory muscles. Sometimes people have a scaphoid chest, which means it's indented. Some people have a flat one. She has a great flat chest, so no abnormal. She does not like her boobs, but great. It's great. All right. So after you look at the size and look for symmetric movement when she's breathing. So her breathing is even on both sides. Nothing's abnormal. No sucking. Nothing weird at all. And then it's important to ask during a gastrointestinal when their last bowel movement was. You don't have to answer that as a private question right now that I'm videotaping. But you want to make sure you ask them that. And if they're having any pain in a certain area, because when you go to touch them, you want to touch the painful area last. Okay? So first thing you do first is you auscultate the stomach. And you do that because if you touch anything before you auscultate, it could leave accessory sounds that you don't want there. So you would start in the right lower quadrant and then work your way around. And they can breathe normally during this time because you're really just listening to the bowel sounds. And if they have hypo or hyperactive bowel sounds, there could be an indication that something's wrong, but that also might indicate that's just their normal. So you really don't know. So it's important to assess more questions with that. Sorry, my cat's in my video now. So then after that, you would want to percuss. And you want to percuss every quadrant. Sounds good. And then you want to press. So you would always ask before you press anybody if they have pain anywhere. Do you have pain anywhere? Mm-mm. Okay. So if not, you would go the same way as you do everything else. So starting in the right lower quadrant, moving up and all the way around. So then you would start with light palpation because you don't want to press all the way in if it's going to cause a lot of pain. And then you go deeper. And then if they have rebound pain, that's a huge sign that there's something wrong. So you really want to make sure that if they're wincing, pay attention if they're wincing, or if they're saying ow, that could be an indication that something is wrong underlying issue. It's also important to palpate their liver. So to do that, you kind of have them breathe in, and then you stick your hands underneath, and then they breathe out. And then the liver should get your fingers in it in. So it's a good placement. And that's just to make sure your liver isn't swollen, because that could be another issue in itself as well. So after you do all of that, if there's any issues with her stomach, or if she has like some weird mass or like a bounding pulse in her stomach, you can assess the aorta, the abdominal aorta, which is usually right in line with the belly button, right below the xiphoid process. You can also do the renal arteries, which is right outside the belly button, the iliac arteries, which are just like a few inches down from the belly button, and then you can also do the femoral arteries as well, which is like right in your left and right groin. Okay, you can sit up. So now that she's all done with all of that, we would also assess, since she's a woman, her vagina area. Obviously, I'm not going to show that on here, but it's very important to assess the skin, if they have any changes in discharge, if the hair is different, if she has any tenderness or redness, inflammation, all could be signs that there is a genitourinary issue. Incontinence is another big one. You want to ask how their urinary system is, if she has any pain when urinating, any burning, all huge signs that something could be wrong. For a male, you would want to assess their testes, make sure that they're even, there's no swollenness in one and the other. You want to make sure they don't have abnormal itching, any weird discharge or burning when urinating. And then you want to go to their anus. So the ANS, you're assessing for hemorrhoids, fissures, any skin breakdown, anything that could cause an issue gastrointestinally. Any incontinence in that area as well can cause skin breakdown due to the acidity of our feces that it can be if it's not digested correctly. So making sure you assess the feces as well. If feces comes out a different color or a different texture than others, that could indicate that there is an issue somewhere in the intestines that will need to be assessed. So it's just important to assess all those areas for skin, changes in discharge, output, anything like that. So that is our gastrointestinal, respiratory, cardiovascular, and genitourinary assessment. Thank you.